Hello, welcome to a new episode from the Grapevine. I'm Tina.
I'm Susan.
I'm Armanda.
And we have Dr. Maggie Stefan with us today. She is a pediatric doctor at Florida Hospital for Children.
Oh, thank you for having me.
Thank you for coming. Tell us about yourself, tell us a little bit.
Originally from upstate New York. I've lived here in the Orlando area for about 9 years. I've been practicing at Arnold Palmer Hospital and Florida Hospital for Children for the past 9 years. I have 2 daughters. They are 2 and 6 years old. And I am board certified in general pediatrics as well as pediatric pulmonology.
Very nice. Tell us, do you see a lot of parents that they have newborns, doesn't want to vaccinate the baby, or?
I think that the general awareness for the importance of vaccination has really been on the rise. I think the vast majority of parents do realize the importance of vaccination. Arguably, vaccination was one of the most important breakthroughs in medicine in the last century. The mere fact that you can provide a way to prevent a disease that is potentially life-threatening to a child was a huge breakthrough in medicine in the last century. The vast majority of parents, I would say, do realize the importance of vaccination and show up on time for their vaccination schedules.
You said you have 2 years old, so do you give her the shots by yourself, or you take her to
No,
a pediatric
no,
doctor?
I have an excellent pediatrician who takes care of that for me. It's very important, even as a professional, always to take your child to a pediatrician because he or she, in my case a she, will have a more objective approach and will be a little bit more objective about what they're seeing. You know, even as a professional in the field, you tend to be very emotional and worry a lot about your children. So it's always a good idea to have a very objective person taking care of your child.
True.
So let me ask you a question. When people don't vaccinate their kids, what do you think the reason, what's the main reason? Is there one that stands out?
Yes, we don't see that very often, but I do have to say that there is still a small percentage of families that do have concerns related to vaccination, and their primary concerns are related to one study that came out about 15 years ago that showed an association between the MMR, or the measles, mumps, and rubella vaccine, and autism. However, since that time, it's been found that that study wasn't a very well-designed study, and that there are really there have been multiple studies since that time that have failed to recognize an association between the MMR vaccine and autism. So the medical community in general has decided that that study is really basically unfound, and the American Academy of Pediatrics strongly encourages parents to vaccinate their children.
There's actually a lot of people that I know that truly believe in that study. And we're always like, no, dude, they came back and they said, no, it's not founded, it's not true. He didn't do it correctly and all this stuff, but they still believe their kids after they get vaccinated, or not their kids, but other kids when they get vaccinated, things change. So I have a 6-month-old, and after she took her 6-month shots, she changed, supposedly. But she's just growing. Mm-hmm. It just happened to be right after her shots.
That's exactly right. You
that
got
it
it
happened.
Right. You got
Yeah.
it right. Yeah. So you will see things or concerns on the internet and in various other social media networking situations where people do express that, my child changed after the immunization, or my child all of a sudden displayed features of X, Y, and Z after immunization. But it is just as you suggested, being a child is a very dynamic process, and children change on a daily basis. From day to day they can change. So it's more likely that you are seeing the normal progression of childhood than you are seeing a side effect of a vaccination.
Yeah, it's really interesting. I know, like, when I was a pharmacist working in a store, it was the same thing, and people would be like, no, definitely not. Or, you know, oh, the thimerosal or the mercury, you know, and all of these things. And, you know, it's exactly like what you said. It's like the chicken or the egg, like which one came first. You know, your baby is growing, right? So they're different every single day. So with that autism, I think what I kept hearing was that really, like, the onset of autism is similar to the time of the vaccination.
Correct.
Is that correct?
That is absolutely true. Yes, that autism really, by definition, is difficulty with social interactions, and right around the age of about 1, which is when you receive your first when children receive their first MMR vaccine, that is when children start to display an interest in social interaction. So there is really no way to say that it was the MMR vaccine when in fact it was more likely just the timing of the events that occurred right around when children are more likely to be interested in social interaction.
How important is the flu vaccine? Because most of people think I will get sick, I will get the flu as soon as we get the flu shot.
Yeah, that's a great question, and it's a question that we get very frequently.
Yeah.
In fact, the influenza vaccine is an inactivated vaccine. So it is really technically impossible to become sick from an inactivated vaccine. I know lots of people report some flu-like symptoms associated with the vaccination, but fundamentally, scientifically, and theoretically, you cannot get the flu from the vaccine because it is an inactivated vaccine.
True. But you know how people think.
Yeah.
What are your thoughts on how effective it is? So I know that's one thing that I keep hearing, like, you know, especially last year and specifically the year prior, about how effective it is and if there's even a purpose of getting it.
Yeah, that's a great question. You do hear concerns from people that the vaccine is generated the year prior. So the way that the influenza virus is that it actually changes from year to year in its fundamental structure. And so it's really, there are scientists in a lab who spend hours and hours trying to predict what next year's influenza virus will look like on a microbiologic level. So really it is based on predictions of what the influenza virus will look like the following viral season. So you do hear some people who have concerns that, well, how sure are we that these predictions actually match up to what you see in the vaccination? If you look at the data historically, the scientists actually do a pretty good job of predicting. There are certain years where they don't do as good of a job as predicting, but if you look at the data in the last 10 or 20 years, they actually are pretty good about predicting what the next viral season will look like, or what the next influenza virus will look like. Some years they do a better job than others, but nonetheless, there are lots of studies and data that show that children who do receive the influenza vaccine, even if it is not a perfect match to that influenza viral season, do have an attenuated or a less severe illness than children who do not. The primary concern is, and anyone who has worked in a children's hospital long enough, we have seen children die of the flu, and it happens every year. And it is heartbreaking. It is beyond heartbreaking to see a child die of a generally preventable illness. You can't really prevent children from getting sick besides using good hygiene, hand washing, hand sanitizing. However, it is very, very, very rare that we see a child die of the influenza virus who has in fact received the influenza vaccine. So even if it is not a perfect match to the virus that is out in the community, it still does attenuate or decrease the severity of the illness.
I heard in the news, I'm not sure if you guys heard it, there's an insect going on right now that bites and people die of it. I'm not sure. I don't remember the whole thing. There is no?
Yeah.
No?
I don't know, but it seems like
Yeah.
every year there's something. So if they make a vaccine for that, I'm getting it. That I know.
It's so scary. Yeah, it
Yeah.
was in the news, I think
Yeah.
2 weeks ago or something. It was-
Yeah.
I don't remember much about it. How about circumcision? How important is circumcision for newborns? And how late they can do that surgery? Because I did it for my 2 boys right after they were born.
Yeah, yeah.
It's painful, so I don't know.
Sure. You know, so is circumcision a medically necessary procedure? The answer is likely no. The advantages of circumcision are that there's generally a decrease in cancers in children who have been circumcised later in life. There is a decrease in STDs later in life in children who have been circumcised. So there certainly are advantages. The disadvantages or risks are relatively minor. Obviously, you know, pain is the primary one. Maybe a little bit of inflammation or infection that might occur afterwards. So it's generally, in the medical community, it's considered an individual decision.
Yeah.
Having said that, as a mother, I think I would do exactly what you did. You know, if I take off my MD hat, I would do exactly what you did, which is to do it in the newborn period. It really is a relatively simple procedure. It can be done really with local anesthesia or even no anesthesia if wanted. And all they do is just incise a piece of the foreskin, and it can be done in a very short amount of time. I've seen doctors do them in less than 5 minutes. So,
do you see people that they don't do it, they refuse doing it?
Yes, I do.
Nowadays?
Yes, I actually see it very frequently. At one point, I think it goes in phases or fads. I think about 10, 15 years ago, I would say there was probably about a 50-50 chance that a mother would circumcise her son at birth.
That's a high percentage.
Yeah.
Higher than I thought.
Yeah.
50%. Wow.
Yeah. More recently, I've seen it become more common or more prevalent that people actually request circumcision or agree to circumcision shortly after birth. There tends to be a strong cultural factor when people decide to circumcise or not to circumcise their children. Some cultures feel a little bit more strongly about it than others. But ultimately, it's an individual decision based on your background and your beliefs. We've seen it go either way, really. And as I suggested, it does tend to go in phases.
One more thing I thought about right now, and not most, but I saw a couple of kids when the mommy was going through natural delivery. I think when the doctor was pulling the baby, the neck got bended or twisted. Something happened, and they will be doing like this all the time. Is that because the way they pulled the neck or the head, or is it because the parent didn't pay attention how to carry the baby, how to put them to sleep?
So those sorts of what we consider minor birth injuries are actually not uncommon. They do tend to occur more frequently in assisted deliveries, for example, with vacuum assistance or forceps assistance, which people don't really use very frequently anymore. what you're describing is an excellent description of torticollis, which is when a child tends to have almost like a muscle spasm in the muscle in the neck called the sternocleidomastoid muscle. And what it requires is just frequently extending the neck. And neck support, of course, yes. Yeah. Frequently extending the neck and doing some minor exercises to help release the tension in the muscle. There are more serious injuries that can occur, and those are primarily when one of the upper extremities is pulled during the delivery, and you can get brachial plexus injuries, which are when children have, floppy arms or arms that lie next to the body, and that is much more serious than the torticollis that is seen a lot more frequently.
We're going through flathead.
Yes.
And so that was an issue
of
the torticollis, but because she only liked sleeping on her right side. And so we had to force her to sleep on the left side, and we had to keep going through that, and but it's getting fixed now. So she's able to do both sides. But that was an issue that we went through, and I never thought anything of it. I was like, she just likes sleeping on her right side. So
she has the flathead just on the one side, just not on the back.
On the back left, back right side. But now it's starting to. Can you tell us more about flathead? Because I feel like now it's starting to work better. It's starting to shape out better, but she still has the top part higher. And so we went to a doctor for it, and a neurologist, and he said that he recommended it. He said she doesn't need it. But
are you speaking about the helmet?
The helmets. Yes. He said she doesn't need it, but if she was my child, I would do it. And then he brought in the people right away to talk to us. I know. I was like, what do you mean? Of course. And so he brought in the people right away to talk to us about the helmet. And it's the company that creates the helmet. And so I was like, how do you have these people lying around? So me and my husband, we kept talking back and forth about it. And we were like, wait, is this a money thing? Should we get it? Or do they want just the money? Is he recommending it because of that, or does she really need it?
Yeah. So it's very common. Yeah. The most common place that you see it is actually the back of the head, because now, the American Academy of Pediatrics recommends
back is best.
The back is best, right, to decrease the incidence of SIDS, because there's been shown to be a 13-fold decreased incidence of SIDS in children who sleep on their backs. We no longer recommend sleeping on the tummy at all. We do, however, recommend tummy time, which is during the daytime, placing your little girl on her tummy just to allow her to build strength in her back muscles, her neck muscles, and to prevent that from happening, to prevent the flathead from happening.
We can get a good 2 minutes of that, and then she starts screaming. And if even 2 minutes,
it's very uncomfortable.
Yes, I love tummy. That's how I sleep. So I'm like, why don't you like tummy time?
Yeah. There are various things that you can do to work with her to try to get her to like it. A lot of things children don't necessarily love in the beginning, but they do become accustomed to it eventually. They may scream bloody murder in the beginning and make you think that something is very wrong. But if you sort of gradually introduce it or desensitize them, as we like to say, go from 1 minute to 2 minutes to 3 minutes a few times a day, they become more accustomed to it. Children's skulls are very soft, just as the cartilage in their ear is very soft. Their skulls are very soft, and that allows for the skull to grow and the brain to grow. So it's very easy for things like that to happen, for the flattening of the back of the head to happen. So she is at a very young age, where 6 months, you said?
6 months,
yes, 6 months. So you can probably still do a lot of things to allow it to naturally sort of regain a more cosmetically appealing structure, rather than resorting to the helmet.
So question for you, because obviously you're the second opinion, but if there was a mother and we didn't have you on our stage, would you recommend in this situation for them to get a second opinion? Because I think the thing that's so challenging is it's your child. We had a similar situation, not with her head, but with my son. And it was a situation where you're like, you will do anything for them. And then you're like, but should I do it? And is it going to hurt them if I do it? So would you recommend a second opinion in that type of situation?
Yeah, I think any good doctor who really cares about you will be totally fine with you going to another physician for a second opinion. And any doctor who is very good and, again, who cares about you will even be willing to give you the names of people that they trust. You know, there's a reason that you have a doctor seeing you and you don't just plug in your symptoms on the internet and come up with an answer, because there's a lot of different approaches, and one approach may make you feel a little bit more comfortable than another approach. So when patients come to me, if they request a second opinion, I'm more than happy to provide them the names of people who I trust, to provide them another opinion.
So yeah, I think we're gonna do that. Second opinion. I'm like, we're going into June in the hot season. I'm like, I don't know if I really want to do it. I know it's the easy way, but like, I feel like we can get it through. So
yes, she's very young. If she were a little bit older, maybe there would be a little bit less room for her to kind of reshape her head. But because she's so young, I think it's a good idea to see if there are other things that you can do.
I feel like you brought up such a good point too with the, the tummy time, and there's so many situations where you're like, oh my gosh, I can't do this with my child. It's torturing them.
Yeah.
But like they're been in your, womb for how long? Everything is new, you know? So it's probably true. Is there any way like you recommend maybe like getting them used to a situation or getting them used to tummy time, like 1 minute and then the next day try to do 2 minutes, or...
That's exactly right.
Oh, really?
Yeah, that's exactly right. Mom knows best. Sleeping is another excellent example.
We're going through that too.
Yes, where so many of our children have what we call a sleep association. In other words, and my children were exactly the same. They associate rocking with sleeping. So or they associate nursing with sleeping, or the bottle with sleeping, or whatever.
She refuses to take the bottle during the day just because she knows if she takes the bottle, she will sleep. So she refuses to take the bottle.
Smart. I have a big problem now. My son is 2.5, and he still takes the bottle to go to bed.
Ooh, that's good.
And he's my third one. Yeah. I never had that problem with my first two.
So you're an experienced mom, and you know what you're doing.
Yes. No, I'm not. So I don't know how to quit it. He will quit milk.
It's hard.
Yeah. Well, I want you to feel reassured that you're not the only mother in that situation. Lots of mothers are in that situation. The biggest concern with putting milk in the bottle at night is dental caries. So if you can even use water as a transition process until he gets to the point where he has broken that sleep association. Children are very smart and they're very strong-willed, yes. And it's important to be able to distinguish what a child needs and what a child wants.
Exactly.
And you're an experienced mom, and I think you realize...
If only they were all the same. They're not all the same is the problem. Every child is so different.
It is true. It is true, yeah.
And he's very stubborn. It's very hard. And when I put water, because I tried, I gained juice. So I tried water, and he refused it. He just left it. And I said, that's fine. You can leave it. But he will be so cranky, keep crying and crying and crying and crying. And
crying it out. What do you think about that?
Yeah, that's a great question. That's a great question.
You should. And I did that. And then I went back. So because he saw the bottle.
It's hard. It's hard. You feel like you're torturing them. But I think it goes back to you know, like you said, like, are they really in pain?
Yeah.
I don't think so.
No.
I think they're just okay. You know, if you're watching them on the monitor, which I'm sure you're doing.
Yes.
And they're fine. You know, I am pro crying it out, but maybe I'm just a mean mom. I don't know. What do you
So
think?
hard to quit.
I left. She was crying for like 30 minutes, and I had to walk out because I started crying. I was like, no. And then I went and picked her up. I was like, crying it out. Like, we're not doing this.
Wow, that's another great question. So it's always important to, as you suggested, check up on your child. Make sure that they're not in pain, that they're not overbundled and too hot, or maybe too cold, or hungry, or ill, or any of the above. And as long as you are comfortable that you can check off each of those things, it is generally okay to let them cry a little bit. It is. I can tell you as a parent that it becomes a lot easier with each progressive child. With the first child, it's a lot harder, and it becomes a little easier with each child to allow them to cry it out. For parents who, and I was in the same situation that you are, particularly with my first daughter. For parents who do have a hard time with it, and this is more for you, but it's also for her. Yeah. You can set a timer on your phone or look at your watch and decide, okay, I can handle this emotionally for 2 minutes. And after 2 minutes, I'll go and tell her, Mommy loves you and she's here, and give her a kiss. And then set your timer again, walk out for another 2 minutes. And just keep increasing the time interval with each time. And a lot of parents find that a more comforting approach, a softer approach, a more loving approach than just deciding, with your husband, today is it. We are no longer going to go in her room, and she can cry from tonight until tomorrow morning, and it's fine. That's very difficult for a lot of parents. Yeah. So to set smaller goals towards a bigger goal is probably more achievable. And you will notice that even in a few nights, that the time that it takes her to fall asleep becomes shorter and shorter with each night.
Yeah, I really like that. Yeah, because she was crying so much. I was like, we're messing with her psychologically. Like, we're doing something wrong. Like, she's gonna think we're not there for her.
Toughen
like,
her up.
Yeah, I was like, she thinks we're not gonna be there for her. Like, we need to go in.
Too smart.
And like, I convinced myself to go in. I was like, no, we're not doing this. Like, I went in, picked her up. She got quiet, went straight to sleep. Like 2 seconds.
And even with the bottle in the bed, you can decide, I will leave him for 4 minutes with no bottle in the bed. And he can cry for 4 minutes, and then I'll go in.
I know I can quit because I did.
Okay.
But I feel bad because he's not going to drink milk anymore.
Oh.
He won't take it?
No
During
matter
the
what,
day?
a straw, a regular bottle, no.
But is that a
Chocolate
big deal
milk?
at 2.5? Like, can you
calcium?
just do cheese?
And yogurt and all that
like
stuff.
all those things.
I try, but I still feel guilty. I don't know why. I really don't know why.
I think at 2 and I feel like at 2.5 it's fine, but clearly I'm not the doctor. I don't know. That's hard.
Yeah, that's his only bottle during the daytime, is at night. Yeah.
One time in the morning, one time at night.
Yeah. Well, there, you know,
honest.
as you suggested, there's alternate sources of calcium. I want you to realize that there is such a strong association between the bottle at night and dental caries, that even though you are very well-meaning and a very kind and loving mother, and you want him to get the calcium, sometimes we may be doing more harm with focusing too much on one thing and allowing them to get away with things that might be harming them.
True, I totally forgot about that.
Yeah, because I think it turns to sugar for the most
Yes,
part, right?
exactly.
And it decays their teeth.
Yes,
It's hard.
That's so true.
Yeah, because lactose is related to glucose and fructose.
Totally forgot about
and so, yeah.
So I have a question.
I'm going to go home.
So at least you have a bottle to throw away. So my little boy, he's my angel, he's 5. And he does it not all day long, but he does it when he's tired or, you know, maybe like a little bit, you know, sad or whatever, but it's definitely the way he goes to bed. And it's so hard because I keep hearing, you know, a lot of Egyptians are telling me, you know, put a Band-Aid on it or do this and that. And I feel bad doing it. I mean, should I just bite the bullet and do it? Or nail polish, yeah. Which I think he'd like because it's cayenne pepper and he probably would like it.
Yeah. Well, so again, a lot of children have thumb sucking or other associations, sleep associations. Has he started kindergarten yet?
He starts next year.
Next year, okay.
He's 5. He's the oldest in the class because his birthday's September, so he's going to be 6.
Okay. So a lot of times, things that are very concerning to us, for example, the thumb sucking, nose picking, eating what comes out of your nose, whatever. A lot of times, these sorts of problems tend to resolve themselves with time. And that is because children, once they go to about kindergarten or first grade, are very aware of their social surroundings and their interaction with other children. And they are very aware that certain things are really socially unacceptable. And those problems tend to resolve themselves. We stress a whole lot about them, and they tend to resolve themselves on their own just by peer pressure. You know, he will go to school and he'll see other children falling asleep. You know, when they're in pre-K, they might not be so privy to social pressures and peer pressure. But starting in kindergarten and first grade, they become very aware of what is acceptable and what is not acceptable. And my sense is that he will go to kindergarten and first grade and realize that this is not acceptable anymore, and I may need to give it up.
Okay, good. Because that's, I mean, honestly, that's my approach. But then you'll hear people go, you know, you can do something for that, right? And I'm like, yeah, I'm well aware I can do something for that. I just haven't tried. You know, I'm actually kind of okay with it.
Yeah.
And I felt like it would resolve itself. So I'm glad. I'm glad I have now doctor approval.
I heard of a child that actually did it till he was like 17.
I know people till now. Like,
Yeah.
21
Yeah.
22.
Yes. So is that like?
Especially
But
by
you know
the
why
time.
I worry
Yeah.
about it.
You
Yeah,
will
they'll
cry.
cover and they'll do it. So is that like?
Maybe it depends on the
That's
child,
my
though, because
fear.
it's funny you said that, because I will say even in pre-kindergarten right now, I notice when I drop him off, if he's sucking his thumb, it's gone. You know, like he's like, yep, that's it. I am just hanging out, you know, wasn't sucking my thumb.
Right.
And so I do think you're right. Like, you know, and then they stop nap time at school, you know, so then it'll hopefully just self-resolve itself.
Well, the reason that you heard about that is that that person is an outlier, obviously. I mean, that's not very typical for someone to
keep doing
their
it.
thumb that
Yeah,
long.
I was like,
so
whoa.
that is why you heard about it. It is unusual.
Okay.
It is unusual.
I feel like that's why we freak out so much. You hear of all these outliers that it's just like, what if that one is my child? Like, am I causing something, or am I not doing something that could have been done to prevent those things? Like with the passy or the sucking of the thumb or the bottle or all these things. It's like mine is still new. So I'm like, am I doing something that causes these things? So is the rocking, like, is she gonna, like, I'm scared that she's not gonna be able to go to sleep without the rocking ever. But I know she's gonna grow out of it. But what if she's that one person that like rocks herself to bed? Like, what is like?
She's gonna rock herself.
Yeah. So is there something that we could or not be doing to affect our kids psychologically? I feel like that's what I'm most scared about. Big question.
No, that's an excellent question. As far as rocking, nursing, bottling, you fill in the blank, to put to sleep, generally speaking, by the age of about 6 months, a child doesn't really need any of those to fall asleep any longer. It is probably comforting, it is probably soothing, it is probably something, again, that they want rather than they need. But you do not have to worry that that they still need that to fall asleep. They are capable of falling asleep on their own at that point. And after the age of about 6 months, a child really doesn't need to wake up in the middle of the night anymore to feed. Certainly in the newborn period, they do need to wake up every 3 hours to feed because their stomachs are so small and they have such a large caloric requirement. But after the age of 6 months, they don't really need to be woken up that frequently at night to feed. So whenever you're ready to set your timer and let her cry a little bit, it will be okay.
We had, she was able to sleep through the night from 8:30 to like 6:30 every night from 4 months. And then 5 months, no, 6 months, 5.5, she started waking up at night. And the whole system got messed up.
Maybe she's hungry. Sorry.
So yeah.
Yeah, they say growth spurts, right? I don't know. I don't remember when they happen.
Well, she wouldn't stop. She wouldn't go back to sleep until she got a bottle. And then the bottles decreased. The ounces, she wouldn't eat a full 6 ounce. She would only, like throughout the day, she wouldn't eat the full 6 ounce. She started only eating 4 ounce. And we would make the full 6 ounce and she would only eat 4. And that was, like, I felt like that was causing her to wake up during the day. So instead of doing 1 cereal in the morning, I started doing 2. 1 in the morning and then 1 in the afternoon. And she still was waking up. So is there something that we could be doing differently to help that process? Because I know, like, there's a lot of other mothers out there, and whenever we talk, they're like, no, my child is doing the same thing. Is it the teething? Is it the growth spurts? Is that what's causing it?
It certainly could be any of the above, yeah. And that is a perfect time for a growth spurt. If and you're her mother, you know her better than anyone. So if you truly feel that she's hungry,
I don't think she's hungry. I think she just wants
the bottle.
The bottle.
Hang out.
Yeah, because sometimes she won't even eat. She'll just suck it. And I tried doing the passy because I was like, because she is teething. So I was like, let me try the passy. And she wouldn't take the passy. She wanted the bottle.
So interestingly enough, all the pediatric gastroenterologists are now recommending the introduction of solids when a child can support their head unsupported. So that's around 4 months of age, which is a huge difference in comparison to what we used to do 5 years ago even. We used to wait till about 6 months. And a lot of breastfeeding mothers still do prefer to wait till 6 months just to promote breastfeeding. But you can introduce solids as young as 4 months of age. Your baby may be a baby that is more likely to sleep through the night and feel satisfied if you were to introduce more solids at an earlier age. She's only 6 months old, but certainly there's no harm at this point, unless, of course, you are very adamant about breastfeeding and encouraging your breast milk.
So I have another question for you. When it comes to breastfeeding and all the pressures that new moms feel around breastfeeding and the length of time, and I hear moms try and beat each other and say, oh, you did, 5 months, I did a year. So from a doctor, what is the recommendation for breastfeeding, and is there any cons to not breastfeeding?
So the American Academy of Pediatrics, again, recommends exclusive breastfeeding, if possible, up until the age of 12 months. However, in reality, that is very difficult, particularly with working moms. We all can try our best, but not all jobs accommodate us pumping every 3 hours and then coming home and having to deal with all the stresses of work and all stresses of home, which can certainly affect your breast milk production. There are services available to mothers to aid them with breast milk production, such as lactation specialists at hospitals and things like that. However, if a mother is unable to produce breast milk for a year, that is certainly not unusual at all. It is probably more common than being able to produce enough breast milk to meet a child's nutritional demands for a year. And formula is a very acceptable substitute to breast milk. The advantages of breastfeeding are related to a few things. The primary one is children who are breastfed during the first year of life generally have less respiratory tract infections and GI infections in the first year of life. Is that immunity carried on later in life? It is probably not. It really only occurs during breastfeeding. There have been some studies that suggest that children who are breastfed have less asthma and allergies later in life as well. But there are also studies that say to the contrary. There are some studies that show that children who are breastfed do tend to score better on IQ tests than children who are not. But that is why we have added DHA to formula. So is breastfeeding superior? It is superior. However, the use of formula is certainly a very acceptable substitute for mothers who cannot produce enough breast milk to last a year.
How about the new thing of going to, I think they're called milk moms or something like that?
Oh, where you can
The
get milk
banks.
from
Yes,
them?
the banks.
Milk banks, that's
Yes.
what it is.
Yeah. So some women are blessed enough to have too much milk supply or hyperlactation syndrome. And what do they do with that milk? They donate it to milk banks or to newborn nurseries or neonatal intensive care units around the country. And if your child is, for example, born prematurely and in a NICU at a hospital, you can ask to have donor breast milk. And there are even people who have decided to purchase donor breast milk online for a very expensive price. That is a personal decision that one must make. There are no strong recommendations either for or against that. That is a personal decision.
But is it the same as their mom's breast milk? Does it matter? Or is it not something that's studied yet?
So your question is all breast milk the same?
Yes.
It's not all the same, no. Some women have more fat content to their breast milk. Some women like myself who are exposed to lots of illnesses in a hospital have more antibodies in my breast milk. So there is individual variability in the composition of breast milk.
Okay. That was always something that I always thought about because there was a friend of mine that she was like, I'm producing a lot. I'll just send you mine. And I was like, no, I don't know.
Yeah. Well, and again, there's an extensive screening process that occurs before that breast milk in a hospital is given to a baby. So the breast milk goes through a whole array of tests.
Yeah.
But online, that seems risky.
Does it still do? Yeah. Do they still do it?
Especially the storage, how they store it.
Yeah.
It's very scary.
Yes.
Thank you very much, Dr. Maggie, and we'd like to have you for another episode soon for more info. Thank you for coming.
Oh, it's my pleasure. Thank you for having me.
Thank you.
Have a great night. Bye-bye.